There will be another pandemic. That is a certainty. Not only that, there will be other reasons to invoke health or danger as a cause for a potential lockdown.
Hello and welcome to Off Script. My name is Stephen Edgington. As the UK COVID inquiry begins, is the narrative around lockdowns being set by politicians trying to cover their tracks and vested interests? To discuss, I'm joined by a former advisor to President Trump and a member of the White House Coronavirus Task Force. He is also a senior fellow of health policy at the Hoover Institution, Scott Atlas, MD. Thank you very much, Scott, for joining us.
Happy to be here.
Shall we begin by you explaining your role originally in March of 2020 when the pandemic struck? What were you doing?
Sure. So in January, February, and at the onset of March, I was in my full-time position as a health policy scholar at Hoover Institution working on a book on reforming the U.S. healthcare system. And it became apparent to me with the news coming out of China about COVID that the rational policy was sort of being ignored because decades, perhaps even centuries, of basic biology was denied about things like getting the way a viral respiratory infection is spread, the protection you get from having recovered from that infection, and we knew a variety of other things, including multiple coronaviruses were already in circulation. It wasn't entirely novel. The data on masks not preventing infection and not stopping the spread of infection was known for viral respiratory infections. And many, many things were known, including simple common sense, which was that we had a population that would be very, very high risk. And that is elderly, frail people, particularly in what we call nursing homes in the US, where even a common cold kills people in nursing homes because they're so frail. Yet most people are much lower risk, generally speaking. This was all ignored, coupled with this overtly wrong information coming out of the World Health Organization, even at that time, which was this extraordinarily high infection fatality rate, which is the number of people who die divided by the number of people infected. And what they said was that there was a 3.4% infection fatality rate, which is extremely high and very scary, frankly. But when you even look for 5 minutes at the original data on the Japanese cruise ship about who had died, about what percent of people died, there was an extreme, and very early data from all over the world, there was an extremely steep gradient of risk by age, meaning very high-risk people or a specific population, very elderly people with what are called comorbidities or underlying illnesses. Yet most people were not at high risk. And in fact, young people who were healthy were at a minuscule risk from this illness as having a serious complication. So I was trying to explain this to my own family at the time. And I have a couple of sons who are smarter than I am usually. But I was trying to explain it to them, and they didn't understand what I was talking about. And I said to myself, okay, if they don't understand, then there's a lot of work to do to explain it. And we all saw the world going into this incredible fear, particularly, but not only in the US and where I live in California. And so I started to do the research myself and write about the risk. And in March of 2020, there were 3 of us independently who called for ending the lockdowns and using a heightened protection of the people who are high risk, but stopping the destruction of low-risk people and children. In March of 2020, this so-called targeted protection that I used as a way to describe it, I wrote it in a newspaper here in the US in March of 2020. Within a week of Johnny Anides, a well-known epidemiologist at Stanford, who also wrote it independently, and another doctor, David Katz, who wrote it in the New York Times. And we were writing about this, and I did the research on my own and compiled the data and started doing some interviews about it because, frankly, it was extremely destructive. It was known since 2006. The classic review paper on pandemic management of viral respiratory infections very clearly explained that lockdowns were both extremely harmful and would fail to stop an infection. And so this was all known. This was the standard to not do lockdowns, yet the world was embarking on this very, very dangerous, in fact, a reckless pathway.
So you were one of the few people, even around the world, who are saying, look, this lockdown policy is the wrong policy, it's not going to work, and it's going to be more harmful than beneficial in terms of saving lives. Why do you think you were able to be so far ahead in that sense? I mean, many people took a long time to come around to that point of view.
Okay, there were a couple of things. It's sort of a complicated answer. The first part of it is that people were afraid to speak against the accepted narrative. And again, I hate to say it, but there's a huge lack of courage in the world today. And this is one of the most frightening things of all, is that people are afraid. Why are they afraid to speak up? There were two that's sort of another way to say, why did the public accept illogical, unprecedented, draconian policies that defied not just the evidence on this virus, but defied fundamental biology and standard logic? Why did they accept that? There were two lies perpetrated on the public. The first lie was anyone who called for ending the lockdowns was saying the economy is more important than lives. And that was a lie. That was denying decades of data and scientific publications in the economics literature that showed that when you have severe economic downturns, you kill people. You literally kill people. And in fact, I wrote a paper with some economists from University of Chicago and elsewhere in May of 2020, calculating that the lockdowns themselves had already cost double the number of life years that the virus cost in May of 2020. The second lie that was perpetrated on the public was that if you're calling for ending the lockdowns, then you're saying, let it rip, let the infection spread, the so-called herd immunity strategy, which again is a complete lie. No one ever called for letting the infection spread that I know of. I never said it. I never said let it rip. It was never said to the president. I never heard anyone say it. It was never even discussed in the White House by the time I got there, which was not until basically August 1st, July 30th of 2020. No one ever said in my presence that sort of strategy, but that demonization was really done by the media. I hate to say your field, but these are propaganda tools that reminded me and are reminiscent of some of the most heinous propaganda that's been used to sway the public in modern history, dating back to things like World War II. I hate to invoke that kind of analogy, but it is a study in psychology to try to figure out why people accepted this. And it was because you were deemed as dangerous and a villain if you called for ending the lockdowns, even though the lockdown strategy was completely antithetical to the data, to fundamental biology, to the previous experience with pandemics. So it was an extraordinary time. And frankly, what was frightening to me was that people believed it.
As I mentioned, the UK is currently hosting a big independent inquiry into the lockdown, and various sides are trying to sort of write history in a way. The pro-lockdown people, the anti-lockdown people. And this is really important because if there is another pandemic that comes along, that narrative will set the policy. Are the same questions being raised in the US?
Well, yes. What's happening, and you've correctly identified this, by the way, I want to say that we need accountability and truth in this. Why? Because number one, we're supposed to be ethical societies, and ethical societies demand truth, especially after what the public has been through. The second reason is we need a public accountability, and in public, we need to demand the apology, the admission of error. We will not get an apology or an admission of error. That's not why we demand it. We demand it because there must be a public airing, because if we don't, the people in power will do this again. There will be another pandemic. That is a certainty. not only that, there will be other reasons to invoke health or danger as a cause for a potential lockdown. We must get this publicly aired. Now, what's happening in the United States is in many ways a rewrite, an attempted rewrite of history. It's the logic of, I like to say, a combination of Kafka and the Mad Hatter's Tea Party and Alice in Wonderland, because this is, the irrational dialogue is the following. Dr. Deborah Birx, who was the White House Task Force coordinator, the head of the medical side of the task force, Dr. Birx, and Dr. Fauci, who was the most visible and most influential person on the task force, even though he was not in charge, are both, they're trying to say, the people that are to blame for the failure of the lockdowns are the people who were opposed to the lockdowns. Okay, the people who were the advocates for the lockdowns, they got what they wanted. They got their lockdowns. The lockdowns were implemented throughout most of the United States, with some few exceptions, like the people who I advised. Okay, like Governor DeSantis of Florida, he ended the lockdowns very early. Governor Nome of South Dakota. Most of the country implemented the lockdowns, and the judgment of the success of the pandemic management lies with the people who got what they wanted, the lockdowners. So if you think that Dr. Fauci was right and did a good job, then you're saying that President Trump and Biden both did a good job. If you're saying that the Trump administration had a bad policy and killed people, then you're saying that Dr. Fauci and Dr. Birx advised a bad policy that killed people. There's no separation between what Trump said and did, what Trump administration did, and what the Fauci-Birx policy was. Now, that said, the President Trump, although he originally was for the lockdowns, he came out against it. He wanted schools to open, and we did many. I personally advocated while I was in the White House, which was from, say, August 1st, July 30th, 2020, through mid-November 2020. I called for opening schools, I called for ending the lockdowns, and I called for increasing the protection of the older people and the people who are high risk. I called for increasing testing of the nursing home workers, because of course all the cases came into the nursing homes through the workers. And when I got to the White House, just as an example, and sitting on my first coronavirus task force meeting, which was mid-August of 2020, Dr. Birx turned to me and said, "We're already doing everything to protect the old people." And I said, "Oh, really? How often are you testing the nursing home workers?" And she said, "Once a week." And I said, "Well, that's not what you should be doing. You should be testing them 3 times a week, 5 times a week, 7 days a week. Because that's who's bringing the cases in." And by the way, when I was saying this, their policy was a failure. The lockdowners' policy, the lockdowns, were not only destroying the young people, and particularly the poor families, but they were also not protecting the people even in the nursing homes, which is a controlled environment. So I said, increase the testing in nursing homes. I said, get more tests where seniors are congregating that are non-residential facilities. They weren't doing that. I said, get more testing to historically black colleges and universities. Why? Because their faculty have higher risk profiles. So there were things they were neither protecting the elderly, nor because they weren't doing enough to protect the people who are high risk. They were also destroying younger people and shifting the burden of the disease in a totally unethical way to lower income people. Remember, in the United States, they deemed certain people essential workers. Who were the essential workers? The essential workers were the people working in the grocery stores, the people delivering the food, the people that were cleaning the hospital toilets, the people who were cleaning the floors in the medical facilities. These were the so-called essential workers. These were generally lower income people. Whereas the affluent class, what Martin Kulldorff, my friend, the epidemiologist at Harvard, often calls the laptop class, they were ordering food in using Amazon to deliver their goods, hiring people to work in the grocery stores and go shopping for them even. So this was a massive and immoral, unethical shift of burden of the disease to lower income families, single parent families. I mean, closing schools? Okay, where I live in Palo Alto, California, it's a super affluent community. Every other house has a PhD or an MD sitting in it. There's plenty of room to have your little micro school for your child. In a regular family, that's not the reality of the world. When you shut down schools and you lock down businesses, what do you think happens? Well, we know what happens. And if I can go on here, the data, the most sinful part of the Birx-Fauci strategy of lockdowns and school closures, the most sinful part of all the Western civilizations that did this, including the United Kingdom early on, America's sins against children are, what happened? Okay, the first spring 2020 school closures alone, there were roughly 300,000 cases of child abuse in the United States that went unreported because schools are the number one agency where child abuse is noted. We had an explosion of anxiety disorder, suicidal ideation. 1 in 4 college-age kids in the U.S. contemplated suicide by June of 2020 because of the isolation. There was an explosion of self-harm visits by teenagers to doctors. What is self-harm visits? That means putting cigarettes on your skin or slashing your wrists. There was a massive explosion of suicides in teenage girls. There was a tremendous amount of drug abuse, substance use disorders. This is in children, in teenagers and college-age kids. This is from the isolation. This is not from the virus. This is not from the pandemic. It's from the human beings that made the decisions to shut down schools, to close businesses, to isolate people. And by the way, they introduced a whole generation of toddlers, of infants in the United States, to this idea somehow that they are a vector of disease. They are a danger to others and others are a danger to them. Where I live in California, even now in 2023, we see young children walking around with masks on outside. We see babies in strollers with masks on their face. And we're just seeing a growing body of evidence, which was all predicted, which all predictable and predicted by people like me and others, that these kids and young people are going to be destroyed by this for a disease, by the way, that they have extremely low risk, what is really a minuscule risk from this virus, healthy children. So as a society, as Western civilization, but particularly in the United States where we close schools, again, with some rare exceptions, because we have multiple different states here, we close schools, we shut down families, businesses and work. We destroyed poor people, we destroyed low-income people, we destroyed our own children, and it continued with the vaccine, where we had vaccine mandates for young children that have no significant risk for serious illness. Why was that done? To use our own children as human shields to stop the spread. We're supposed to be an ethical society. I'm a father, okay? My children are not to be a shield for me. I am a shield for my children.
It's interesting, in the UK, a lot of the messaging was about saving the NHS, protecting the NHS, the National Health Service. And a lot of people in the UK argued, well, the NHS is there to protect us. We're not there to protect the NHS. And I want to talk a bit about Britain, because we are coming from a British perspective. I know that you worked on the task force in the White House. Did you ever have any contact with the British? Were you looking at what the British were doing, or were you looking at what other countries were doing? And if you were sitting on that COVID inquiry in the UK, what kind of questions would you be asking?
We did look at Britain quite a bit, people like me, because we looked at, I looked at all countries. We had to understand the data from everywhere. And again, just to put in a unique point about a unique politician, and I don't have a favorable view of most politicians, especially from what I saw, but Governor DeSantis of Florida, the first time he called me was in, say, April 2020, but way before I was in Washington, and he started reciting the data and said, "Tell me if I'm wrong, Scott," and he knew the data. This was unusual. So anyone who was a thinking person wanted to look at all the data from everywhere, and I did that and followed what was happening in the UK. And of course, the UK, in a way, in a not unreasonable way, some of the things in the UK really set the ball rolling for these horrendous lockdowns. And what do I mean by that? The models. okay, the models of Ferguson and his colleagues, who had been proven wrong over and over again in their previous work and were extreme, garbage in, garbage out is the sort of way to look at this, which is that when you make these assumptions in these models and you make these hypotheticals, well, if there's bad assumption going in, the end result, of course, is ridiculous, and that prompted a massive amount of fear.
So just so viewers can remember, Ferguson was saying that hundreds of thousands of people would die if we didn't lock down in his models.
Yeah, and millions of people in a variety of places. And of course, and he continued to be disproven over and over and over again. And his model was not the only model that was disproven. There were numerous models that were disproven. They couldn't even predict, the IHME model that was based in the state of Washington here, they were wrong even on their 24-hour in advance predictions. And so, but the public was unaware, because normal people don't spend all the day looking at the models. They don't have time. They don't have an interest. They got their, but B, not just because they didn't spend the time looking, but because the media, particularly the U.S. media, which was uniquely poisonous, and I can go through the data, there's evidence that they were uniquely negative and harmful to the public. The U.S. data kept track of the prediction rather than the actual fact that the predictions were wrong. And so they kept saying, oh, and I was interviewed myself about this many times. Oh, this model says this, what do you say about that? Okay, but we already knew what was happening. We had the actual records of what was happening. So the models of the UK were extraordinarily harmful, and I looked at that, of course, as everyone did. We were looking all over the world. And over the summer, I was, the only real direct contact I had in the UK was late in the summer, once I got into the White House with one of your really extraordinarily capable epidemiologists, Dr. Sunetra Gupta of Oxford. And I think what she and I had in common before we even talked to each other was she and I were probably the two of the most vocal, if not the most vocal, pointing out the unethical, horrendous harms to children and the poor from the lockdowns. Okay, she looked at it from her UK vantage point. I looked at it as an American. The bond is simply that we are ethical people. It had nothing to do with politics or anything else. So in the end, we all learned from each other. We were looking, and I was actually at one point quoting her. And eventually, I got her to fly into Washington, and we had a meeting with some people in the government.
So the overall question this lockdown inquiry is going to ask, essentially, is whether all of the lockdown, the things we talk about, closing schools, which we did, by the way, the same, maybe less so than in America, but we certainly did that for long periods of time, whether all of these lockdown policies were worth it. So my question to you is, was it worth it?
Well, no, it was horrendous. It inflicted massive damage, and it didn't stop the spread. And this is data. This is not an opinion. This is fact. And the people that are watching, we're in an era now, before I say the data, we must recognize as thinking people that trust has been lost in public health, in the so-called expert class. They have been revealed, really, by the pandemic as politicized, non-critical thinkers, motivated by other things, whether it's financial or other gain, power, whatever. We're in a world now where we, as individuals, must take the responsibility of being critical thinkers to make the best decisions for ourselves, our families, our children. We must take that burden on. It's sad, but the undermining of trust was caused by the people in the expert positions, by the expert class, who were wrong. They won't admit they were wrong, and they continue to dig in and try to rewrite history. So what is the data? Okay, Bjorn Skov, March 2021, he reviewed something like 40 European countries, and his conclusion was the lockdowns did not reduce the death. Ben David, Stanford, January 2021, the severe lockdowns did not prevent the spread of the infection. Agrawal, USC and Rand Institute, June 2021. Not only did the lockdowns not prevent deaths, when the lockdowns were instituted, the deaths went up. They're correlated with deaths increasing. The lockdowns actually cause an increase in excess deaths Excess deaths means deaths beyond what would be there if there were no pandemic. Okay, Herbie, Johns Hopkins, the lockdown should be abandoned as a public policy because minimal, if any, impact. Kirpin, Casey Mulligan, University of Chicago, in 2023 published their data analyzing the states. And this turns out in the US, of course, there are 50 states, and they also included Washington, D.C. So of the 51, the top 10 performance on three quantitative criteria of economic problem, education, and death. The top 10 states were the states that opened early, including Florida and South Dakota, governors DeSantis and Nome. And the worst 10, bottom F grade, F for fail, were the states that had the most severe lockdowns, including my state of California, Illinois, Pennsylvania, New Jersey, New York, Washington, D.C. The most severe lockdowns were the most destructive, and the lockdowns failed. Period. End of discussion. That's not an opinion. That's the data, no matter what the other side wants to pretend is true.
So in 2020, you were in this task force, you were an advisor to President Trump, but as you mentioned, you were also advising other politicians, some governors, so you mentioned DeSantis, for example, and DeSantis and Trump are now vying for the Republican nomination for president. Who do you think was more effective and more correct, in a way, on that lockdown issue?
Well, I mean, DeSantis, you have to look at the facts. Okay, it's not really an opinion in a way. DeSantis put on lockdowns April 1st of 2020. And then rather quickly recognized that this was very harmful, destructive, and wouldn't work, and actually was immoral, if I may speak for DeSantis, and I spoke to him many times over the summer. And so his record in Florida is that after 2 full years, okay, the pandemic, you could argue was over way before 2 years, but let's just say the 2 years of the pandemic, DeSantis in COVID deaths, per age-adjusted COVID deaths, okay, per capita, meaning per person, of course, did better than 60% of states in the U.S. And his excess death calculation, which is the most legitimate way to calculate, was better than my state of California. Now, what does that mean? Well, okay, first of all, the burden is not on the states like Florida that opened up to prove they did better in death. The burden is on the states that did the lockdowns to prove they saved lives. Because the people like Florida, the states like Florida, did not impose massive harms from the lockdowns. In fact, for the school year of 2020-2021, the academic year that begins in the fall of 2020 in the U.S., Florida opened up all schools. I flew at the request of Governor DeSantis to Florida, and we toured the state in August of 2021, and he said, Scott, tell the data. I said the data at the press conferences. We visited schools and universities in the fall of August 2020, and he said we're opening all schools, in-person schools. Whereas states like California, for the 2020 to 21 academic year, California only had 17% of students had in-person schools. Okay, that's destructive. So Florida did better than most states, and better statistically than the state of California, no matter what Governor Newsom of California wants to claim. DeSantis was one of the few with a large, diverse state who took it upon himself to know the data and open up. Now, Governor Nome of South Dakota also did well. She took it upon herself to know the data in consultation with me and others, and kept her state open and did very well. But South Dakota's a sort of a different sort of an environment. It's not the large, heterogeneous, urban, rural, ethnically diverse place that Florida is. So Florida's a good comparison for a state like California. The President Trump role is very different, okay? The president in the United States does not have much authority in terms of the state-by-state pandemic management. That's a state-based decision to lock down or not. But what you can do as the leader is not abrogate responsibility to bureaucrats like Anthony Fauci or Deborah Birx. These are people, Fauci and Birx, who were in bureaucrat positions for 20, 30, 38 years. They're not active scientists. They're not doctors in the true sense of the word in their activities. They've been bureaucrats for decades running organizations. And what I saw is they had no idea how to think critically. At the task force meetings, I would bring folders of the studies, up-to-date studies, dozens of studies, 20 studies, 30 studies, and recite the data. Birx had these sophomore compilations of cases by state and then took arbitrary color coding and said, oh, let's say these are red, these are yellow, these are green, therefore these are dangerous. Well, you're defining. There was no basis for that. It was all, I've never seen such a low-level analysis in my life. I was giving the data. I was used to that. I was in an academic medical center for most of my career, and then for the last decade plus, I was in a very highly academic organization, a public policy think tank at Stanford University, Hoover. So I wasn't used to that. But
how were they responding to you when you brought the data to the table? How were Fauci and was it, what's her name?
Birx.
Birx.
B-I-R-X.
How were they responding?
Okay, well, this was it was very frustrating for me because although I knew in advance, I was asked to help the president as an advisor after I went to Washington for one day and had a bunch of meetings. And at the end, Jared Kushner said to me, we'd like you to help the president. Advisor. And I said, okay, but this is what you're going to get. You're going to get, I'm not going to change what I say no matter who tells me to. I'm not going to sign on to a group statement if it's incorrect. I don't care who tells me to. And he said, that's why we want you. And I said, okay, great. And then he said, but you're going to be destroyed once it becomes public knowledge. I'm concerned about that you're advising President Trump. And so I said, well, okay, it doesn't sound so good. So I'm going to go home to California and try from there. But it doesn't work from a distance. It was sort of chaotic. There was a lot of pressure. Things were being told to the President of the United States were completely wrong. And people were dying. And so I said, okay, I'm going to come back to Washington because it's my country. People are dying. And we have grossly incompetent people advising the president and actually dictating the policy. So this was sort of, going back to my answer, this was a sort of an abrogation, I view, of responsibility. You don't delegate authority. You're in charge. And what do I mean by that? Birx and Fauci, their advice was wrong. The lockdown advice was destructive, incorrect, and it was killing people and failing to stop the spread of the infection, but failing to stop the people from dying who are high risk. Like you need to make a change. And I view the White House itself was being politicized by saying, okay, but there's an election coming up. They would tell me, stop rocking the boat. And so the way I was received at the White House task force when I would bring in the papers was Vice President Pence would run the table task force. He would, like the de facto head of the task force, the titular head of the task force. And he would say, Scott, what do you think about the risk to children? And I said, well, and I went through the 10 minutes of reviewing all the data. And then silence from Fauci and Birx. Except Birx would then say, you're an outlier. This was the refutation. There was never refutation of what I said using data. Never. So literally never.
Almost an ad hominem.
It was not just almost ad hominem. You're British, so you're more polite. No, it's not almost. It's direct. It was the only argument was, I'm an outlier. Okay? I'm proud to be an outlier when all the people who are not outliers are completely wrong on a level of destructive, not just buffoons, but horrible incompetence, gross incompetence. People don't understand the depth of the incompetence. And the only refutation of what I said was simply to say that I'm not in the mainstream. Okay, well, so what? This is supposed to be basically, science is debate. Science is, here's the data, here's the conclusion, use critical thinking. These people didn't even look at the data in a critical way. What I mean by that is when you're a medical scientist like myself, you end up looking at a study. And the first thing you do is you look at the study design, what are called the methods section in a scientific paper. If the study design is significantly flawed, the conclusions are not valid, period. This is critical thinking. I'm used to running journal clubs. I'm used to being a journal reviewer. I had more than 30 grants in my career. I published over 120 peer-reviewed scientific papers. I'm used to doing this. I'm not a bureaucrat. I was not at all experienced, frankly, in a government type of model. I had a feeling there was going to be a lot of backlash against what I said because these people were saying this for 5-6 months before I walked in. They were wrong. The people kept dying in the public. It was really a sinful level of incompetence. So I'm an outsider. And frankly, I told Jared Kushner, I don't want to be on the task force because I'm not going to be able to sway these people. I'm not going to be accepted. I'm an outsider. He said, well, no, but it's very important, which he was right. It was important for me to hear what they were saying and to make the case. But there was no scientific debate. In fact, people like Fauci and Redfield, the head of the CDC, and Birx, when they would say things that were so wrong, so low level, even non-medical people in the task force room would say, no, Tony, Dr. Fauci, that's wrong. You know that X, Y, and Z. Or someone else would say, well, Dr. Redfield, but couldn't it be just that at the time the masks were put on, the cases were already coming down? I mean, these are obvious questions. The level of competence was so low that people would be shocked. And I don't know if that's how it was in the UK because I wasn't in the room. But given the outcomes and given what they did, it sounds like a bunch of government bureaucrats who didn't know what they were doing sort of either panicked or thought they must do something, but they were destructive in what they did. It's not just the lockdowns failed. They destroyed people.
It's fascinating because you had Trump and you had Boris Johnson at the time, and I think Boris in the UK, his instinct was very much towards freedom, it was very much towards anti-lockdown. You can see some of the messages he was sending, some of the people he was meeting, including people who signed the Great Barrington Declaration and others. But his scientists and advisors were telling him, you must lock down or people are going to die. Now, I don't know what Trump's instinct was, whether he was on the side of freedom or lockdown, or whether he was being led by his advisors.
Well, I can tell you. Yeah. I mean, the way it worked was in the spring, Trump, before I got there, Trump was convinced about doing these temporary lockdowns by Birx and Fauci and others. And then by June, July, before I got there, President Trump was talking about we need to open the businesses, we need to open the schools. I got there, and the first thing I did in the beginning of August was I said, let's have an open the schools kind of event in the White House, and we invited, and this was already in concert with what the president was saying. But here's the problem. In the White House, there were two parallel messages being given to the public. The president was saying we need to open, we're going to destroy people. This is in summer and then later in the fall of 2020. But Birx and Fauci was the official White House policy was the coronavirus task force. Okay, so what do I mean by official? First of all, Fauci was the most visible person. He was in media, I would say at least once a day on average.
He became a sort of celebrity in the US, right?
He was, yes, and he still is in some people's eyes, shockingly. But again, it's partly human nature. The people don't want to admit they were wrong and they bought into this. So I guess psychology is they're going to keep doubling down on this rather than admit complete error because it's a sinful error. It's not just an inconsequential error. But the other part of it was that Birx personally wrote all of the White House guidelines to the state governors. The official guidelines were written by Birx and the White House task force. The official visits to the states, with sometimes the vice president on his plane or without the vice, was by Dr. Birx. The official voice of the White House was Birx and Fauci. The official testimony to Congress about what was the advice to the public was Birx and Fauci, and the CDC, which was headed by Dr. Redfield, who was also on the task force. So these were the people that were the official policy. But in parallel, you had an unusual situation where the person supposedly in charge was the president, supposedly in charge of the federal policies, and he was saying something very different. And then I was out there as an independent advisor saying the data and trying to allay the fear, because fear itself is a very destructive thing because it makes people behave irrationally. But I was also saying the facts, because in my view, the way to persuade the public is with the data, not with some kind of a filtered data or a lie or a distortion. And so I was out there, and I was told several times in the White House, which I wrote in my book, by people in the West Wing, in the administration, I was told many times, this is in September 2020, October 2020, Scott, we have an election coming up. Don't rock the boat. And I said, the boat is already capsized and people are dying. I don't care about the election. I mean, this was, again, like completely repulsive to me, and something that we all need to grapple with, frankly, as a society. We have politicians who have the incentive to be reelected or elected, and we are in a world where the truth doesn't matter, where what takes precedence over doing the right thing is that we have an upcoming election? No, okay, no. And this is where there's a disconnect, and it also leads to the solutions of these things. There's a disconnect of people who are outside government. I don't care about there was no secondary gain to me. In fact, it was at my own destruction to some extent because of the media frenzy and everything. But, we need to do the right thing. Okay, G.K. Chesterton has one of my favorite quotes, which I say frequently, which is that, right is right, even if nobody does it, and wrong is wrong, even if everybody's wrong. And so, we need to step up, what I say, rise up, which means speak up in a free world, or we're going to let our society completely crumble. Okay, people were dying. And that's not acceptable. I don't care if there's an election or not. And so I was fighting that fight sort of seemingly alone. For 7 months, I had been speaking out against the lockdowns and for targeted protection. I wasn't the only one, but I was one of the few. And then over the summer, other people started to. And then finally, 7 months later, the Great Barrington Declaration was written, which codified this idea of targeted protection and came out against the lockdowns. And this is very important as a document because it gave people something to say, I agree with that. So although it was late, because during the 2020 lockdowns of the spring, summer, and fall, I mean, there was a massive amount of destruction. But this was a very important document because it gave some people something to say, yes, I agree with that.
It sounds like Trump was almost delegating responsibility to the scientists rather than sort of having that leadership role himself.
I think this is that's a reasonable comment to make because and I think we saw this all over the world. I think we had this sort of strange episode in history where the so-called experts, who were not experts, they were wrong and they were buffoons, frankly, they were delegated the authority, whereas the real role, in my view, of what it's supposed to be is that you advise the president or you advise the prime minister, but the person elected to lead has to step up and lead. And so what we saw in the U.S. was all the state governors, the presidents, 2 presidents in a row, they hid behind the CDC. Okay, the CDC is nothing to hide behind. That's an advisory agency, just like in the UK or in the European Union, they have these similar bodies. I mean, the experts are just there to advise. I mean, when I was an advisor to the president, one of the things I tried to do, and I did, was I said, okay, I'm going to get people who are doing the research on the pandemic to come in and meet with President Trump. And I said this from the beginning of August 2020. And so I organized a group of people, Jay Bhattacharya of Stanford Medical School, Martin Kulldorff of Harvard Medical School, Cody Meisner of Tufts Medical School, Joe Ladapo of UCLA, and myself. And we had organized this meeting with the president simply to answer his questions. And we arranged it so that Dr. Birx would be allowed to come on her schedule. And the day before the meeting, she sent an email around saying she's not coming to the meeting because it's not good for her to be there. Okay, so to me, that's an indication of a complete insecurity, I would guess. You can't defend your own positions, or you don't want to learn from experts. I was inviting people who were scientists who were doing the research, but I wasn't there to debate. I was there simply to answer the president's questions. She said she wasn't coming, and they tried to therefore cancel the meeting. And I sort of said, well, no, these people are already here. I'm sorry, it has to be done. And so to Jared Kushner's credit, he said, okay, but you got 5 minutes. 5 minutes with the president. We went into the White House, into the Oval Office. We all 5 of us sat there, and I presented the 5 people, including myself, to the president in the Oval Office. And President Trump went through and asked each of us very pointed questions about the pandemic. And we answered, and the meeting went on for 45 minutes to an hour because and he asked the right questions, and he wanted to know the answer. That's the role of an advisor. You're there to give information, to answer the questions. You're not there to run the policy. I'm not there to take charge. And, we had people in the task force like Dr. Fauci or Birx and these people. They had friends in the media. They would literally go to their friends. They would say to me, oh, I'm going to go and talk to Sanjay tomorrow. Sanjay is Sanjay Gupta of CNN. I didn't know who these people were in the media. I wasn't friends. I was there to advise the president. I was there to stop people from dying. I wasn't there to keep my own position. I didn't even want the position. I didn't even know I'd be public. So these are people whose motivations are very different. Government employees, people whose careers are in government, by definition, have a different motivation than external people who don't need the job.
It's fascinating because in the UK, we also had these sort of politician scientists. And I remember doing an interview with another sort of someone like you, sort of an external scientist who'd never been in government or never worked with, in the civil service. And he was saying, I know these people. I taught these people. They are not good scientists. They are more political. That's the incentives for them is to boost their career within that government organisation. It is not to do serious scientific research.
This is my opinion as well, is that people that have a position, their career is in government, they end up, even if they're well-intended, they end up having different incentives. Their incentives are not necessarily financial. There are all kinds of corruption. I like to think of it as moral corruption. They're interested in the power. They're interested in getting the standing ovation when they walk into a restaurant, which happens in Washington, D.C. for some of these people. They're interested in rubbing shoulders with the powerful. I'm not interested in that. I don't even come from that background. I have no interest. I don't buy into these people. I don't care about people's titles. I'm not from that background myself. I don't necessarily even respect that. But we need to be thinking people. We need to care. I never understood the issue of morality and sort of virtue or virtuous society until I saw the opposite thrown in my face there. That, we really need to understand that people in government positions have different incentives. And this is an argument for what we would call term limits in the U.S., which is, one of the solutions. We can't have people like Dr. Fauci's of the world. He's been in this position in the NIH for 38 years. Okay, this is not, that's not a good situation. Okay, we need to have people who are external, who don't have a specific personal gain from serving the country. We need to have people who want to serve the country, ideally for the purpose of serving the country, and then getting out and leading their own lives.
It's fascinating because you talk a lot about the politicization of the virus, and I think that took hold far more in America than in the UK. It really became a sort of culture war issue where you had the Democrats on one side with the triple masks, and you had sort of DeSantis on the other side, who was against lockdown. And Trump was a really big part of that. He was a very divisive figure in that sense. And I know that you've mentioned, you personally were sort of under attack by the media and under attack by the Democrats and others. And it says even on your Wikipedia page that you spread conspiracies around masks not being effective and social distancing not being effective. That's the word they use, conspiracies. So how do you view this the politicization of the virus in America?
Well, I'll first answer, Wikipedia is not a legitimate reference. It's a disgrace. It's sad that people under 30 think it's a good reference. It's not objective. And in fact, I'm happy they say that I spread those things because I was 100% correct in everything I said. So I accept their apology, even though it will never be written that way. The politicization is really very destructive, and there's evidence for the politicization. In the United States, a Gallup poll taken relatively recently showed that there's a massive divergence in opinion about simply trust in science. Okay, the overwhelming percent of Republicans identified as Republicans have very little confidence in science. And the overwhelming percentage of Democrats have high confidence in science. Why is that unusual? Because for 30 years, the same survey was done, there was no difference in political party. It's just since the pandemic there's this massive split. When you don't have trust in science, that's frightening because we're supposed to be an objective society. The Earth is not flat, okay? And so the people that believe in masks at being effective, these are flat earthers of today. Okay, there is no debate about that in a rational world anymore. There should have not been a debate. It was known in the spring of 2020 by all the data on influenza, and influenza is the same size virus as this virus that spread basically the same way. That was known. These people are flat earthers, so that's frightening. There's another interesting survey about the politicization, and it happens in the vaccine era. In mid-2022, about half, almost half of Democrats said that you should be in jail if you won't get the vaccine in the United States. And about a third of Democrats, I'm being rough on the approximate numbers here, I don't remember the actual data, about a third of Democrats said that you should have your children taken away from you by the government if you don't get vaccinated. Okay, now what kind of society is that? I mean, this is really, that's sick. That's something that we should be frightened about. We should be discussing these things. There's this mob mentality, this demonization of people, and that's very frightening. We should be very, very concerned about that.
And I'm going to ask one more question, but just very briefly, you aren't a Republican. I mean, you said you were a registered Democrat. Are you happy to talk about that? I don't know. But I want to give people an idea of, you're not some sort of partisan hack chosen by the Trump administration.
Well, I mean, the sort of politicization was manifested by the people who themselves are politicized. If you see everything through a political lens, you start accusing everyone else of being political. And this is the irony of all things. I went to Washington, like I say, I'm an American. The President of the United States calls me up and says, will you help in the biggest healthcare crisis in the century? My job is a public health policy expert. That's my job, with 25 years before that of being a medical scientist at some of the world's greatest universities. The answer is absolutely yes, I will help. People are dying. And, I think there's something wrong with you if you say no. And yet, so then the attacks came very, very severe. I mean, I wasn't really prepared for that. I thought, okay, I'd be able to argue with the media. It doesn't bother me to argue. I mean, I'm sort of I sort of like to confront people with the truth because, the facts are facts and that's how we're supposed to live. But the politicized attacks were very vicious. They were sick lies put forward about me. And you sort of alluded to it, but you'll never read my political affiliation, which my voting record is public record in the United States. But, somehow I'm depicted as some kind of a political, like you said, you used the words political hack. I mean, Stanford University, where I work, and I've worked here for more than 20 years as a faculty member, these people, the voting record of Stanford zip code, 94% for Biden, 3% for Trump in the Biden-Trump election of 2020. They're the extremists. That's extreme. Okay, the California was 2-1 Biden to Trump. A third of people in California voted for Trump in the Biden-Trump, but only 3% of Stanford faculty who live in this postal code voted for Trump. Okay, that's an extreme population. They came out and censured me in this sort of ad hominem, bizarre letter by people who are really out of their league. I mean, of course, they wouldn't understand the data. That's not their field. That's my lane. But that was a political attack. It became much more than that. The whole world was not reacting to Trump. I'm not naive enough to think that, but I do think it began as very political. And again, to these people, facts don't matter. The American media was uniquely vicious. Something like outside the US, the English-speaking media stories on COVID during 2020, 54% were quantified as negative. just over half. In the US, 91% were quantified as negative, even when the cases were going down. Okay, so there was a very strange, negative, harmful media narrative in the US. And of course, we all get our information through the media. We're people, we're normal people, whether it's social media or otherwise. In addition, a lot of the stuff was censored, including my own posts showing data. When I was advisor to the president, you would think that Twitter or anyone would understand that the advisor to the president's thoughts should be known to the American people. It's not helping to stop information. It's hurting people. They hurt people, and when you censor health policy, you kill people. When you censor health policy, it's not some vague sort of concern about diversity of views. When you censor health policy, you are killing people, and they killed people by doing that.
Final question. Do you expect there to be another lockdown in our lifetimes?
I think we're set up to have more lockdowns, yes, and that's a horrible thought because they're so destructive, they're proven to not work, and they were known to not work for 15 years before this whole thing. And now, what are we hearing? Well, we're hearing the World Health Organization. We see a World Health Organization, let's put it this way. For months during this whole pandemic, they not only praised China for so-called transparency, which was completely opposite to fact, they then said China was the model for pandemic management. China was the most barbaric country in the world for lockdowns. They are a barbaric country if you judge them by what they did to their own people during the lockdowns, period. And yet the World Health Organization is praising them. That's very frightening. And we see all the analogous sort of comments being made, that many of which are politicized, about things that are not pandemics, like climate change. Okay, are there health effects from polluting? Of course there are deleterious health effects, yes. I'm not even talking about what the facts are about climate change. What I'm saying is that there is a precedent set. The people in power are liable to use their power to lock down people again. I could see it happening. I think if I had to bet money, I would predict it will happen. I will bet money it will happen. And the frightening part, as an American, in a country founded on individual liberty, on freedom from an imposing government like the British government in those times, we were founded on these principles, yet there was very little pushback about the lockdowns. We had one of the most acquiescent populations in the world. There were protests about the lockdowns, if you may remember, in the UK, but also in Spain, in Italy, in France, in Germany, in the Netherlands. Yet in the US, there was almost nothing. Were there any protests? Yes, there were. I know, individual people, but generally speaking, there was a shocking lack of pushback. And you have to wonder what's going to happen, because without people okay, frankly, in my opinion, and I'm an American, I'm biased, but America stands for freedom. America is the beacon of freedom in the world. And if America does not push for freedom, it's over. Not just in the US, it's over everywhere.
Thank you so much, Scott Atlas, for joining us.
Thank you.